Explore how HIPAA compliance empowers nurses to safeguard patient privacy and security, ensuring confidentiality in healthcare. Gain insights into protecting sensitive information and upholding patient rights effectively. This presentation simplifies complex regulations and highlights vital practices for nurses. To start, we will explore an overview of HIPAA, Protected Health Information, or PHI, the HIPAA Privacy Rule, the HIPAA Security Rule, patient rights under HIPAA, and common HIPAA violations. Get ready for an enlightening session. HIPAA, enacted in 1996, aims to protect patient health information, ensure confidentiality and security, and enhance healthcare efficiency. It applies to healthcare providers, health plans, and clearinghouses, standardizing the management and protection of patient data across all these sectors. Understanding protected health information, or PHI, is crucial for healthcare providers. This includes names, addresses, and sensitive details like medical records and insurance information. PHI can be found electronically, in paper records, or shared through verbal communication. Protecting this information is essential to maintain patient confidentiality. Now let's shift to the HIPAA Privacy Rule. The Privacy Rule enforces a minimum necessary standard, ensuring health information is only shared when needed. It requires patient consent and authorization for using their data beyond standard medical purposes. Finally, it sets strict limits on how patient information is disclosed, safeguarding privacy. Permitted uses of PHI include treatment purposes, payment procedures, and healthcare operations. Understanding these can guide nursing professionals in ensuring compliance and maintaining patient confidentiality. Securing electronic protected health information involves utilizing administrative measures, like policies and training, physical measures such as secure access and locked areas, and technical measures, including passwords, encryption, and firewalls. These are essential components of the HIPAA Security Rule. In addition, here's Understanding Your Rights, a guide to HIPAA for patients. Patients can access their medical records. They can request corrections. Patients should get a notice of privacy practices. They can also request restrictions on certain health information disclosures. Now let's consider common HIPAA violations. Discussing patient information in public areas can lead to unauthorized disclosure. Accessing records without proper authorization breaches privacy regulations. Sharing login credentials compromises system security. Improper disposal of records risks unlawful access. Posting patient information on social media is a serious violation. Learn about the Breach Notification Rule. Notify affected individuals when a breach of protected health information happens. Report the incident to the relevant authorities. Ensure thorough documentation of the breach to maintain transparency and accountability. Now let's turn to nursing responsibilities. Nurses should maintain patient confidentiality. Verify patient identity before sharing information. Follow facility policies on information sharing. Secure devices and documentation to prevent unauthorized access. Report suspected breaches of patient information security. Focusing on HIPAA in electronic health records emphasizes protecting patient data. Use secure login credentials. Log out from systems after use. Avoid accessing unnecessary records. Protect mobile devices from unauthorized access. These measures ensure privacy and data security. Now let's look at documentation and compliance. Ensure documentation is both accurate and completed promptly. Avoid including any unnecessary information in records. Make sure all records are stored securely. Understanding the consequences of non-compliance with HIPAA is crucial. Legal penalties and fines can be imposed. Non-compliance also risks your employment. You might face disciplinary actions. Lastly, it could harm your professional reputation. Follow the minimum necessary rule for patient information. Engage in HIPAA compliance training regularly. Stay up to date on policy changes. Foster a privacy-focused culture in your workplace. Report any compliance issues immediately to the proper channels. As we wrap up, remember that HIPAA safeguards patient information. It enforces strict controls like the minimum necessary standard, ensuring privacy and security through administrative, technical, and physical safeguards. Staying informed and vigilant ensures compliance and protects patient trust. Thank you for your commitment.